First of all, I'm going to say it again. My name is Maya, and I'm just going to ask you some questions.
Okay.
First of all, I want you to say and spell your name, as well as your job and what you do here at the VA hospital.
Okay, my name is Scott Sandstedt, Sandstedt. I'm a psychologist who serves as the clinical manager for behavioral health here at the Truman VA. And my primary role is to help new patients access mental health services, and then also help facilitate the flow of established patients through our different services and teams that we have available.
Okay. Well, my first question is, what is mental illness, or what does it mean to have a mental illness?
And that's a good question, because I think when somebody hears the term mental illness, they automatically think of things they see in the movies or in the news, some type of severe psychosis, delusions, hallucinations, schizophrenia. But really, mental health concerns fall on a wide spectrum. And basically what makes them a concern or eventually a disorder is if a cluster of mental health symptoms causes some type of impairment in functioning across one's life roles. So, if you look at the spectrum, you will have individuals who are functioning maybe quite well throughout most of their life roles, and they can engage in their daily tasks and activities without any problem. But there's just some aspect of their life that they want assistance with. Motivation. They want to learn how to communicate better with a friend or a loved one. They want to perform better at something. And so while those concerns don't necessarily reach diagnostic criteria, those can be considered mental health concerns. And then at the other end of the spectrum, you do have those mental health concerns that cause significant difficulty in functioning in life, in family relationships, work, roles as an employee, and then just all feelings of self-worth, self-esteem, and ability to enjoy life. And so, fortunately, we do have services available that treat veterans who fall along that spectrum of need.
Okay. Well, next question. Is there one mental illness that's more common than others, or maybe one that you guys here at the VA hospital encounter on a frequent basis?
Post-traumatic stress disorder is probably the one that comes more readily to mind. PTSD is identified or is diagnosed when a veteran is exposed to a trauma scenario. It doesn't have to be military-based. It could happen before going into the military. It can happen after. But during that exposure, they experience intense feelings of, or there's a sense of vulnerability and helplessness, where there's assumed danger to themselves or to the physical integrity of others. And so with that exposure, there's a set of residual symptoms that the individual might be bothered by recollections of the trauma event. They may engage in avoidance behaviors so that they don't expose themselves to things that might remind them of the traumatic event. And then they have general symptoms of anxiety, hyperarousal, difficulties with concentration, sleep difficulties, a sense of hypervigilance, always being on edge a little bit. And so those are some of the common symptoms, or some things you'll notice with somebody who has post-traumatic stress disorder.
Okay. How common is it for people to have mental illness in general, or maybe across the men and women of this age demographic here at the VA hospital?
So about 20% of, across the overall general population, 20% of individuals have been diagnosed with some type of mental health concern. And I think the rate for veterans is going to be a little higher for that. The thing you have to keep in mind is the data is only reliable when we can really assess and measure what's out there. Mm-hmm. And for those individuals who are reluctant or unable to get help, then we don't have a really clear idea of how prevalent mental health concerns are. But for those who do access mental health services and receive evaluations, approximately 20% receive a diagnosis. Within the veteran population, I believe the age 30 to 45, 46 has the highest prevalence rate for mental health concerns. But realistically, mental health difficulties are experienced by individuals from all age groups, the veteran population, the non-veteran population. It doesn't discriminate by any means.
Okay. And so you spoke about PTSD with the veterans. Is depression something these veterans usually experience along with that?
Yes, most definitely. With PTSD, some of those symptoms I mentioned, particularly some of those avoidance behaviors, keep people from doing things that they like to do. And we all need to engage in leisure activities and feel the freedom to engage with different aspects of our life so that we can maintain a sense of balance, maintain a sense of self-worth and a positive self-esteem. One of the hallmark symptoms of depression is negative or low self-esteem. And so you do see some what we call comorbidity, where you have one condition that impacts the development of another position. But outside of PTSD, we do see veterans just with depression, and those could be due to significant difficulties managing life stressors or concerns that we all have, whether or not they occurred in the military or not.
Okay. And just with depression in general, what are some of the leading causes of depression, do you?
Loss of any type, and that can be broadly defined. Obviously, loss of a family member, loss of a job, loss of some aspect of an individual. If somebody becomes disabled or has something taken away from them that they always knew to be there, that's the primary cause. There's also difficulty adjusting to new situations that might be causing some stressors that are difficult for the individual to manage. So loss and adjustment are the two primary contributors.
Okay. And I know we're here in Columbia, which is a college town. Do you think depression is something college students may face at a higher rate, maybe in today's age, or just in general?
Sure. I mean, it's being a student has it's an exciting time in one's life, but it can also be very challenging because people of college age are becoming individuals, more independent. They have more responsibilities that they must bear on their own, and many people can adapt and do well with that. Other people may have difficulties. So again, as I mentioned, with loss and adjustment, difficulties with some type of adjustment being the hallmark sources of depression, there's a lot of transitions and a lot of things that college students need to adjust and to adapt to. Now, more times than not, there's things built in the college experience that help people deal with that. Very strong opportunities for social interactions and social outlets. We achieve a lot of our human needs through our social relationships. So, college students who may be having difficulties with transitions, if they can lock into a functional social group, that helps them with to adapt and help them kind of get their feet on the ground, so to speak. So, but specific to depression, I mean, you will see periods of mood disturbance and difficulties with sleeping and concentration, appetite, because of the overwhelming difficulties they might be having with those transitions.
Okay. Is there a way to decrease someone's depression? I know with mental illness, it's not really something you can get rid of, but is there a way to better manage it?
Again, there's a spectrum of maybe not the spectrum. There's a variety of different interventions people can do. As I mentioned, engaging in social support is very helpful. So there's two categories: things that non-clinical interventions and clinical interventions. So non-clinical interventions would include engaging in functional social support networks. Exercise there's a lot of research that talks about the effectiveness of exercise with mild to moderate levels of both anxiety, depression, and other mental health concerns. Um, let's see. Engaging in hobbies or leisure interests is also very important, so people can take time away from the other stressful activities and responsibilities they have in their life. So those are three examples of non-clinical interventions. Clinical interventions include different types of counseling modalities, to include individual counseling and also group counseling. And then, if indicated, medication management. Research shows that the combination of medication management with counseling is the most reliable way clinically to help manage mental health concerns.
Okay. Can you maybe, sorry, I should have asked this earlier, just define depression in its base form?
Sure. Depression, there's two hallmark criteria for depression. One is experiencing significant feelings of depressed or sad, hopeless mood, more days than not throughout the week, and then also experiencing significant loss in self-esteem. So those are the two main. Also, you have anhedonia, which is significant loss in leisure activity, loss of interest in leisure activities. And then you're going to see some parallels with anxiety and depression, in that you have difficulties with sleep, you have difficulties with concentration, memory can be impacted, but overall just kind of disturbed affect, difficulties with motivation, initiation are common symptoms. Suicidal ideation is an unfortunate but can be common symptom of severe or major types of depression. Yeah.
All right. And with mental illness in general, is maybe not, but is there any one thing that an individual can do to help someone with a mental illness?
It's a good question. There's two different answers to that question, and that depends on the person who's experiencing the mental health concern. If the person is wanting mental health services, then helping that individual do the legwork to help identify mental health services that might be available in the area. If that individual has insurance, helping that individual contact the insurance company to see what clinics and hospitals would be on that individual's plan to get support or assistance. If they don't have insurance or any types of coverage, there's a variety of different mental health, community mental health services that offer sliding scale or sometimes even pro bono free services for individuals. It's just a matter of going online and finding out what those resources are in the respective area. Then you have the individual who either is aware or not aware they're experiencing mental health concerns, but either way, they are not interested or wanting to seek mental health care. And an individual can't force somebody to get care. We find that if people are here because somebody else tells them to come here or forces them to come here in some way or another, they don't truly benefit from the services we can offer. An individual needs to be ready for care. So what an individual can do then for their loved one or friend who may benefit from mental health services but doesn't want it, is to help them look at the ways that their behaviors are negatively impacting their lives. How is what they're doing impacting the goals they've set for themselves? Asking them what their values are. A lot of people will talk about, well, I value my family. I value, it could be even materialistic values. Well, it could be easy for then that individual to say, well, you say you value your family, but clearly you're not feeling like yourself, or something's wrong because it's impacting your relationships with your family. You value these materialistic things, but your depression, or it seems like you're depressed and you're not able to get up and go to work on time, and so that's putting your job at risk, and so you won't be able to afford some of these material things, for example. So those are the two type of things that can be done to help individuals who have mental health concerns.